part of the continuous improvement that I'm looking at is not just a technical issue. It's also, can we streamline the application process? What are we doing to give people more assistance in the application process? How do the call centers and the people who are helping folks in person, how are they trained so that things can go more smoothly? Because the bottom line ultimately is I just want people to know what their options are in a clear way. Buying health insurance is never going to be like buying a song on iTunes. It's just a much more complicated transaction. But I think we can continue to make it better. All of which is to say that on December 1st, November 30th, it will be a lot better. But there will still be some problems. Some of those will not be because of technological problems, although I'm sure that there will still be some glitches that have to be smoothed out. Some of it's going to be how are we making this application process more user-friendly for folks. There are going to be ups and downs during the course of my presidency, and I think I said early on when I was running, I am not a perfect man, and I will not be a perfect president. But I'll wake up every single day working as hard as I can on behalf of Americans out there from every walk of life who are working hard, meeting their responsibilities, but sometimes they're struggling because the way the system works isn't giving them a fair shot. And that pledge I haven't broken. That commitment, that promise continues to hold. The promise that I wouldn't be perfect, number one, but also the promise that as long as I've got the honor of having this office, I'm just going to work as hard as I can to make things better for folks. And what that means specifically in this healthcare arena is we can't go back to the status quo. I mean, right now, everybody is properly focused on us not doing a good job on the rollout. And that's legitimate, and I get it. There have been times where I thought we were kind of, slapped around a little bit unjustly. This one's deserved, right? It's on us. But we can't lose sight of the fact that the status quo before the Affordable Care Act was not working at all. If the healthcare system had been working fine, and everybody had high-quality health insurance at affordable prices, I wouldn't have made it a priority. We wouldn't have been fighting this hard to get it done, which is why when I see sometimes folks up on Capitol Hill, and Republicans in particular, who have been suggesting, repeal, let's get rid of this thing, I keep on asking, what is it that you want to do? Are you suggesting that the status quo was working? Because it wasn't, and everybody knows it. It wasn't working in the individual market, and it certainly wasn't working for the 41 million people who didn't have health insurance.